Hello, my name is Haley Allen, and this is case study number 2. Today we'll be discussing a 4-year-old child with the diagnosis of autism spectrum disorder, or ASD. His vocal ability is full sentences, can tact, can man, can have interverbal conversations with adults, but not too much vocal ability with peers. This client's particular behavior concern can be kind of funny. I find myself and my clinical manager trying not to giggle during our sessions. This client laughs profusely and closes the electronic device. So you'll be kind of talking to him or running trials with him and caregiver, and out of kind of nowhere, he'll just shut the laptop laughing. And then, of course, mom has to log back in and all those things. Of course, this wouldn't be a super huge behavior, but mom reports this is happening across various therapies and up to 10 times per hour, and sometimes even more. That's just the average we found. This is a really big issue because it's happening during speech, ABA, psychotherapy. I don't know if the client gets any other services that it may be affecting, but mom is really concerned that it may be affecting his ability to learn and how much time he gets with each of these therapies. I know for ABA, all the time we have in our 1-hour sessions are really, really important. So she really would like this to stop. And then also, I believe mom is a little bit frustrated with having to continuously log in. And next we'll go into kind of what is operant extinction. Later I'm going to talk about how we use extinction with this client, but first we really want to define it. So Cooper defines it as withholding reinforcement for a previously reinforced behavior decreases the rate of that behavior. This is a tactic, process, and principle known as extinction. Usually with extinction, we think of withholding whatever the functional thing the child is trying to get out of it, so that we no longer really give access to those things when the child is exhibiting in those behaviors. There also are times where we use extinction to stop, unwanted or dangerous behaviors, and it can be, a big range of behaviors. Now we'll move on to how did the clinical team, myself and my BCBA, use extinction with this particular client. So of course we wanted to extinguish the behavior of closing the electronic device during session time. We had to kind of figure out the function of the behavior, which we'll talk about a little bit later on. But in essence, we had to limit the attention that was provided when he was engaging in this behavior, and then also quickly start the therapy again to remove any possibility that he might escape any demands or anything that's continuing this behavior. Again, why did we choose this behavior to extinguish? Mom was really concerned about limiting learning time and him not being able to grasp all the concepts and all the new skills that we're teaching, psychotherapy is going through, and then also speech therapy. To identify the function, we used a functional behavior assessment, or FBA. Of course, we talked with caregivers. Caregivers also collected ABC data since they're the main practitioners kind of in the home with the client. And then also we observed this behavior happening and discussed it a little bit with mom after the behaviors would happen away from the client's ears. By doing that functional behavior assessment, or FBA, we were able to find 2 functions of behavior, or hypothesize these 2 functions of behavior. One is attention, usually attention from mom in the form of like scolding or yelling or like, no, no, no. And then the other one was escape, so escaping that demand of whatever the therapies are putting on him. So we came up with a reinforcement system to kind of give him both of these things that he's trying to get through attention and escape, but in a more functional way. So first, we used a differential reinforcement of other behaviors, or DRO. So when the client was doing anything other than closing the laptop or, some other attention-seeking behaviors, we would really reinforce, I love how you're playing, I love what you're doing. Very similar to like non-contingent reinforcement, but this would just kind of be more on an interval. We would tell mom at least every minute or so, since it was happening very often. We also used generalized reinforcers, so we gave him tokens also within those times. And then we also reinforced a lot for him asking for a break or asking if he can do other activities first or communicating when he wanted to do his work so that also he could get that functional escape by communicating. The previously stated interventions and reinforcement systems really worked well with this client. And mostly due to stimulus control. So we wanted to talk about what stimulus control is. Stimulus control is defined by Cooper as occurring when the rate, latency, duration, or magnitude of a response is altered in the presence of an antecedent stimuli. So really, in essence, it's saying when an SD is presented, is the client or the behavior controlled by that SD or that antecedent. So how we use stimulus control for this client is we taught mom to deliver an ST. Oh, it's time for work. And also with priming and things like that. But in the most basic sense, kind of let him know when therapies were coming up and when it's time to play or when it's time to work, and really giving him the tools to discriminate between work and break time so that during work time, he knows, okay, it's not really time for me to close the laptop right now. But during break times or even when we, leave ABA session via telehealth, he's able to close the laptop and say, okay, bye. So that works really, really well for this client. Thank you very much for watching this brief case study, number 2 on my client. I hope you really enjoyed it, and here are the references I used.